Hi everyone, I am Dr. Aparna Govil Bhasker. I'm a bariatric and laparoscopic surgeon practicing in Mumbai in India. The purpose for this video today is to discuss some of the common problems which are faced by patients after bariatric surgery. So bariatric surgery, as we all know, is a procedure in which we basically reduce the size of the stomach, and in some of these surgeries we may actually reroute the intestines and attach it to the stomach pouch. Now this basically, first and foremost, what it does is that it leads to restriction of the amount of food that a person can take orally, and it is very important to relearn how to eat after bariatric surgery, and this is a guidance which is actually provided in detail by the bariatric team and the bariatric surgeon, bariatric nutritionists and everybody else on the team. So it is important for a person to eat very little in the beginning, and by little I mean that the portion size has to be very small, because if you try and take very large portion sizes, or if you eat fast, or if you swallow very quickly, or try and eat more than you can, then you may get a choking sensation. You may feel like the food is getting stuck in your chest, or you may, if it's more than that, then you may actually vomit the food out. So vomiting actually is not a normal phenomena after bariatric surgery. So if you are vomiting and you're not able to tolerate food, I think you need to first revisit the way you are eating. You need to eat slow, you need to chew your food properly, you need to basically take smaller portions and swallow them also slowly. Another very important thing is that you must not drink water along with food. Water must be taken at least 20 to 25 minutes after taking your meal. So that's one thing. This is one of the most common side effects that is faced by patients in the beginning. Second thing, of course, is most commonly patients are concerned about hair fall. Now, bariatric surgery induces weight loss to a very this weight loss is quite massive in some patients, and it is basically a catabolic phase where the body is breaking down, and hair fall to some degree is expected. So it is very important for you to maintain your multivitamin, iron and protein levels so that this hair fall can be limited. The good news is that the hair fall is temporary and transient, and your hair will all it will all regenerate, and by the end of 1 year or so, I think the hair fall usually stops and the hair starts regrowing. So that's another side effect which concerns many people. The third thing is that a person must not smoke or have alcohol after bariatric surgery. Smoking, especially, if you must always inform your patient or your doctor that if you're a smoker, and it is important because smoking can land you into deep trouble. It can lead to something called as marginal ulcer. It can increase the acidity, and hence it is very important to stop smoking before bariatric surgery. And you must remember that smoking can never be started again. It is extremely important. Same holds true for alcohol. Alcohol will just give you empty calories. Moreover, after bariatric surgery, it is not digested properly, so you will get high with even very small quantities of alcohol. Plus, it is extremely detrimental for your liver. So it is advisable to stop smoking and alcohol completely. And the last thing that I would like to discuss in this video would be nutritional supplements. So any bariatric surgery would induce restriction in the amount of food that you can take. Hence, plus there are some surgeries in which there is also malabsorption, where you don't absorb the required nutrients in your body, so like multivitamin, iron and calcium, etc. Hence, it is very, very important to follow the supplementation guideline that has been provided by your bariatric team. So these must be taken. It is important to take multivitamin, it is important to take calcium, it is important to take iron, and it is also very important to take protein supplements. I know that a lot of patients actually do not like the taste of protein supplement, or most of the times, despite advising, they don't end up taking the required amount of protein. But please remember, if you do not take protein, you're going to lose a lot of fat-free mass, which basically includes your muscles. And post-bariatric surgery, weight loss does not differentiate between fat loss and muscle loss. If you don't want to lose your muscle, please take protein. Of course, it is also very important for maintaining your immunity and for conducting all the functions in your body. Same holds true for multivitamin, iron and calcium also. If you don't take these supplements, you are going to get nutritional deficiencies, and the more severe these deficiencies get, the more difficult it becomes to treat them. So these common side effects after bariatric surgery can be sorted by a little bit of cooperation by the patient, and of course good guidance from the medical team as well. So there is really nothing to worry. If you are following these basic things, I think you will be absolutely all right. And if you have a problem, please do not hesitate to connect with us at any time. Thank you so much.